Hi, this is Dr.Shuba Shekar Reddy, taking care of NICUs, complicated pregnancies, perinatal medicine. We'll continue in this session. This is how the blood flow happens. See, we are discussing this as three separate units: mother, fetus, in between there is a placenta. So we are defining it completely separately: mother, placenta, and fetus. Once we speak about the mother, in the discussions from now, we will be concluding with the placenta. Whatever we speak from the mother, whatever the changes that is happening from the mother, we will be ending the discussion with the placenta. Similarly, whatever the changes that is happening from the fetus, we will be ending the discussion with the placenta. Because placenta is how we will be considering this as the placenta is an end organ for the mother. Directly don't connect the mother with the fetus, so that we will be understanding the better way. To understand a very better way, we will be seeing these things like you consider the placenta as an end organ of a mother. Like kidney, adrenals, brain and heart, these are the end organs. We will be considering the same thing like placenta. Placenta is an end organ. Whatever the changes due to the hypertension or anything that is happening with the placenta, will be happening the same thing with the renals and also brain. That's where in the preeclampsia, whatever that is, if you want to understand, we'll be coming further. Okay. When the changes are happening with the placenta is an end organ. When there is a high resistance, low resistance of the uterine arteries or anything, the same amount of the changes will be happening with the other end organs. So while you are considering from the mother side, you end the discussion with the placenta. Consider placenta as an end organ. Similarly, for the fetus, we will be discussing about the organ structures, and then the flows, uterine artery flows, umbilical arteries flows, various Dopplers, and then we end the discussion with the placenta. We don't directly connect with the mother. Similarly, mother flows or mother discussions has to end with placenta as an end organ. Don't directly jump into the fetus. You got changes వచ్చాయి. The changes that happened here should not be directly jumped with the changes of the baby. So we end with the placenta. Consider placenta is an end organ. Why we are repeatedly saying this? When there is a decreased or when there is an increased resistance with the placenta, obviously the same resistance that the mother will be having with the other end organs. That's where in the preeclampsia there is a seizures, renal failures, or liver failure. All these things are happening because of changes that is happening. These are like end organs only. Coming to slide number 12. This is most important discussion that is happening now. What we will be discussing here is this is what that we will be seeing in the monitors. In the regular monitors, what we will be seeing is these things like a diastole, systole, pleth waveform. If you are seeing a waveform, whatever that we are seeing in the monitor, the radiologist will be seeing somewhere in the monitor the same thing in the Dopplers. Okay, so we are comparing these two things, how we should compare and how we should correlate the things that we are discussing now. Okay, see, this is what we are trying to discuss. If you can see the pleth waveform and all these things, okay, now there is a systolic blood pressure, diastolic blood pressure, something like a mean arterial blood pressure. If any end organ, see, I said that for the mother, the placenta is an end organ. Similarly, for the fetus, the placenta is an end organ. When the end organ has to be perfused adequately, the mean arterial blood pressure has to be maintained normal. You have to maintain the mean arterial blood pressure. What all that we do in the NICU or PHU or adult ICU, wherever it may be, in the ICUs, what we are trying to do to safeguard the end organs is to maintain the mean arterial blood pressure. What is the mean arterial blood pressure? If you can see these things, the mean arterial blood pressure is 1/3 of the systole plus 2/3 of the diastole. Why we are saying this? What is the importance of this? 2/3 of the diastole blood pressure means the perfusion of the end organs, either kidneys, the adrenals, brain and heart, depends upon the mean arterial blood pressure. In the mean arterial blood pressure, maintenance of the diastolic blood pressure is the most important thing. Because further the changes, if we are speaking like a decreased diastolic blood flow, absent diastolic blood flow, we will be speaking about the changes that is happening with the mean arterial blood pressure. That's where the end organ perfusion will be defined. End organ perfusion will be defined with these diastolic blood flows. What we will be doing in the ICUs, obviously we are trying to increase the diastolic blood flow or increase the mean arterial blood pressure to make the perfusion of the end organs. That's how the urine output comes. When the urine output comes, that defines that the mean arterial blood pressure is normal. Okay, this slide is very important. Now we will be considering. You can see the mean arterial blood pressure. In the mean arterial blood pressure, you can see only 1/3 of the systolic, 2/3 of the diastolic. You can see what is the pulse pressure, diacrosis, diastolic blood pressure, and mean arterial blood pressure. Remember this mean arterial blood pressure. For the mean arterial blood pressure, 2/3 diastolic blood pressure contributes. Diastolic blood pressure. Okay. Now slide number 13. So you can see this in the monitor. This is what in the monitor, beeping sounds, everything. What will be the ECG changes, pleth waveform changes, heart rate, respiratory rate, same thing. These we will be seeing, we will be calculating that the mean, you can see 132/73, the mean is somewhere around 90. That is something like 1/3 and 2/3 of the systolic blood pressures. Now, this is how the oxygen flows. Arterial to alveolar oxygen flows. It's like these things. The delivery of oxygen to the tissues is slide number 15. The delivery of oxygen to the tissues. See, that's what we are discussing now. Now we have understood what is the blood flow, mean arterial blood flow, the blood flow. What is the oxygen in the blood? What is the oxygen in the blood? How the oxygen in the blood is being circulated throughout the fetus is being discussed now. The delivery of the oxygen to the tissues is something like a cardiac output times concentration of the oxygen in the blood. See, that's it. DO2 is nothing but delivery of oxygen. Delivery of oxygen to all the fetal organs or the end organs depends upon the cardiac output times. How many times the cardiac output is pumping, cardiac is pumping, how much ml is the baby pumping, followed by what is the content of the, how much amount of the oxygen content present in that blood. Okay, that's how the delivery of oxygen. Okay, the delivery of oxygen depends upon cardiac output times the concentration of oxygen. Concentration of oxygen. Oxygen is carried in the blood, one in the plasma, and other thing is binding to the hemoglobin. So, if you can see, the one that is bound to the hemoglobin is much higher, 1.34 times the hemoglobin into saturation of oxygen. So, predominantly the oxygen in the blood for the fetus is being carried through the hemoglobin, less through the plasma. We understood what is the mean arterial blood pressure, how is the blood flow, what is the diastolic blood pressure that is been contributing for the mean arterial blood pressure. Similarly, when we speak about the oxygen that is being supplied for the fetus, we should understand the delivery of oxygen is depending upon the cardiac output times the concentration of the oxygen in the blood. The oxygen in the blood is bound to the hemoglobin. Predominantly, the oxygen will be delivered through the hemoglobin and very less through the plasma. Okay, this is what that is. We'll continue in the next session.